Hello guys, welcome to my channel. My name is Kanika Arora and you're watching my channel The Medical World. So welcome back guys. Our today's topic is about the first aid practices. I will explain you each and every practice. As you know, first aid is the life-giving process. It is one of the medical skill that anyone can have. It is a very good work just to save the life of any of the person. If you're a non-medical professional or any person who is not in the medical profession and do not know any type of medical skill, this video is for you. Anyone can watch this video. So let's start the video and I will explain one by one what are the practices in the first aid. So let's start the video. The first step in the first aid is the immediate action. This is the key to the preserving life principle, that is quick response to an accident that can save life and minimize the risk that get the things more worsen. If someone or anyone needs help, either from the injury or sickness, you should not hesitate to help them if possible. In the first aid, whenever you saw an accident or anyone is injured, you have to take the immediate step, reach at the place so that it can save someone's life. For example, I will explain you by the help of example. If someone is having accident and he or she is having a lot of bleeding, so our first immediate step is to reach at the place as soon as possible, or if we are near to it we have to reach that place. If there is crowd, we have to just remove the crowd from here there, because the person who is suffering can get the fresh air and the proper ventilation can be provided to a person so that there cannot be any type of oxygen deficiency as he or she is having too much bleeding, right? Then we have to open our first aid kit, take out the bandage and the Dettol, whatever we are solution we are using. Then we have to properly bandage it so that the blood can be stopped, and it can we can say it can save someone's life. It can prevent the blood wastage and it will prevent the further complications of lot of blood loss. So this is the immediate action. Therefore, our second step in the first aid practice is calming down the situation, as if any accident occurs there will be so much stress and pressure around the environment. So whoever is giving the first aid should have the skill of remaining calm, firstly because so much pressure should be there as he is saving someone's life, and the environment should be clear. As I told you, further, just remove the crowd in order to give oxygen, as well as the stress level of the injured person will be also in control. And reinsurance can provide more support, that is if you might expect in the emergency situation, and help people make the decision. It means that you have to give reinsurance, you have to encourage the injured person that everything will be okay, emergency is just receiving fast, so that the situation can be cooled down to the some extent and the decision can be made better in this type of stressing situation, you can say, because everything is stressful. Injured person is also stressful, the person who is giving first aid is also under pressure, as well as the environment can be also stressing as well. Next one is call for the medical assistant. Make sure to get a hold of the emergency services by call 99 or 911 as soon as possible, either by calling directly yourself or asking a bystander to do so if you are preoccupied handling the injury. This will ensure the medical professional arrives quickly to handle the situation in a more comparative manner and provide more specialized treatment. So you have to call 911, that is the ambulance number. Here I have written 999. In some countries there are 999. So the main number is 911. Okay, so always call when you need us any type of medical assistance. Always call the 911, that is the ambulance number, so that the ambulance can arrive on time. The last step in the first aid practices is to apply the relevant treatment. Before the medical professional does arrive, you will need to apply first aid treatments in order to stabilize the condition of the injured person. This comes under the preserve life banner and follow of procedure. Firstly, check for consciousness, then is open the airway, then check for the breathing and follow the airway breathing of recitation. Administer CPR if needed. Check for circulation and check for bleeding, controlling any major bleeding. So in next slide you will see one picture and I will explain you how does it works. So you can see on the screen, this is the basic life support chart. These are the steps how you have to react. First one is the D, that is the danger. Ensure the area is safe for yourself, others, and the patient. So first, if there is crowd, just remove the crowd. Then response, check for response, ask name or squeeze the shoulder. Then is send for help. You can call 911, right? For the ambulance. Then is airway. Then the next step will be airway. Check the airway. After see airway is clear, then check for breathing. And if breathing is not clear, then do the CPR. If CPR doesn't work, then you have to attempt the defibrillation. Thanks for watching this video. I hope you all like this video, as these are the very important topics in the medical profession. If you are a support worker or you are a nurse doctor, this video is for you. Please do definitely watch this video, and thank you for supporting my channel so far, and don't forget to subscribe if you have not subscribed. Thank you.